Good evening, you're watching Left, Right and Centre. I'm Vishnu Shom. The big breaking news story coming in now. 17,282 COVID positive cases in just 24 hours in Delhi. That's right, 17,282 cases in just 24 hours in Delhi. The positivity rate in Delhi now at 15.92%. 104 people have lost their lives in the national capital in just 24 hours. This is a crisis now in the national capital. This is the biggest one-day surge that we have seen. This news coming in right now, and even now, as these numbers are being reported, there is no lockdown which has been announced. There are steps which have been announced, but nowhere close to what we've seen in Maharashtra. And the question really needs to be asked, what is the Delhi government waiting for before announcing more stringent steps, perhaps a lockdown? Because with these cases and the fact, as we shall talk about on this program, infrastructure, medical infrastructure being stretched to the hilt, surely more needs to be done at this stage. Now, this all comes at a stage when there have been over 1,000 COVID deaths in India in 24 hours, the first time in 6 months, with 1.84 lakh cases in 24 hours across India. India now has more COVID cases than both Brazil and the United States combined in this time period, 24 hours. With these numbers, India's healthcare system is right on the edge of capacity in many areas. In our big cities, capacity to deal with COVID cases is being added, but the flow of patients has been described as a tsunami. And at this stage, no one knows where this is headed. On this program, doctors, frontline workers, those who've survived COVID, and those whose loved ones are in the middle of it now, as we look at the struggle that common citizens face across increasingly large parts of India. First, this reality check on the situation in the national capital.
Families waiting for hours for the final rites of their loved ones at crematoriums, one of Delhi's biggest graveyard running out of space. India recorded over 1,000 deaths in the last 24 hours, the highest since mid-October. At Delhi's biggest crematorium, Nigambodh Ghat, the number of cremations have gone up from 15 per day to over 30. Delhi recorded 81 deaths yesterday, highest since early December. 27-year-old Gautam, who lost his grandfather to COVID last night, has been waiting since 8:30 a.m. But even after 5 hours, the last rites have not been done.
यहाँ सुबह 8 साढ़े 8 बजे से है और अभी 1 बजने को है, कोई सुनवाई नहीं है और एक एम्बुलेंस में 3 पेशेंट आए हुए हैं और एम्बुलेंस भी प्राइवेट है.
At Delhi's biggest graveyard near ITO, the JCB is constantly digging more graves and space is running out.
ऐसा है जैसे 4 तारीख से शुरुआत हुई थी, तो शुरुआत में तो ये था कि 2-3 हो रही थी, लेकिन अब 4-5 दिन से तो ये हो गया है कि 17, 15, 16 ऐसे डेली आ रही हैं. अच्छा है, तकरीबन अभी तो 100 तकरीबन कर देंगे जितनी जगह है हमारे पास.
100 की बची है जगह पास.
हाँ जी, उसके बाद बढ़वाना पड़ेगा. जो कोविड ब्लॉक है वो तकरीबन भर ही जाएगा
अगले 10 दिन में.
हाँ, अगले 10 दिन में. उसके लिए फिर कमेटी से आगे बात करके बढ़ाएंगे.
Mortality is going up. This is because probably of late reporting to the hospital, और बहुत सारे चीज़ लोग मिस कर रहे हैं सिम्टम्स को. कोई अगर बुखार घर पे हो रहा है, रिपोर्ट नहीं कर रहा है, and they are coming to the hospital at the final stage.
But many are queuing up at hospitals, say there is a shortage of hospital beds.
सुबह से हम चक्कर काट रहे हैं. सेंट स्टीफन हॉस्पिटल में मैं इमरजेंसी करवाया उधर, वहाँ कोई इलाज करवा दिया, फर्स्ट एड करवा दिया, पर तो बेड नहीं मिला था. तो ऐप के थ्रू सारा ट्राई कर रहे थे, सारी जगह में कोई सबसे पहले फ़ोन कोई नहीं उठा रहा. ऐप में पता करने के लिए बोल रहे हैं, ऐप में कोई दिखता नहीं है. हम तो एम्बुलेंस में लेके कितना चक्कर काटते रहेंगे.
Currently, 85% of Delhi's ICU beds with ventilators and 88% ICU beds without ventilators are occupied.
Throughout the pandemic, the Indian government has emphasized how our nation has been better at dealing with COVID because our deaths have been low. But with the second wave, the reality is changing, and it is evident not just with the numbers going up over 1,000 within the last 24 hours, but also through the scenes at crematoriums.
In New Delhi with Saurabh Shukla and camera person Sushil Rathi, this is Kirti Dwivedi for NDTV.
Well, joining us now, Dr. S.K. Sareen, the chairman of the Delhi government's panel on COVID-19. We are also joined by Dr. Madhu Handa, the medical director at Moolchand Hospital here in Delhi, one of the largest hospitals in Delhi. Dr. Anjan Trikha, chairman of the clinical management group at the COVID Center of the All India Institute, and Gaurav Gupta, who's had a very difficult time in getting to a hospital spot in Delhi for his father and mother-in-law, I believe, managed to get one in Noida at this stage. Dr. Sareen, let me come to you first. These numbers are astounding, 17,282. Now, I know you're testing more, but the fact is we've got these numbers now, and these numbers may well increase. In a situation like this, is it not recommended that there is some sort of a lockdown in Delhi?
Well, I'm no one to suggest all that. I'm just a simple doctor. It will not be possible for me to suggest, but yes, self-lockdown I would strongly recommend, and everyone should and can do it. And self-lockdown is mask up, no make mistakes. Governments cannot stop pandemics. Public stops pandemics. Government can only suggest and support.
Dr. Sareen, I'm just, you are the chairman of the Delhi government panel on COVID-19. I'm asking you, sir, directly, have you in any way suggested to the Chief Minister that there be a lockdown?
Well, I have not been either asked and I have not suggested, but I think these are the policies, and the Delhi government is now by and large, kind of advised by the central government. So the Lieutenant Governor and others and the senior people in the ministry, they would decide and advise.
Doctor, the positivity, Dr. Sareen, one more question before I go to my other panelists, is at 16%, 15.92% at this stage. When will you reach capacity in terms of hospital bed availability at this rate?
Well, the surge is very alarming, and it is unprecedented anywhere in the world, the way the rise has occurred, and we must realize this is possibly because of a very mutant viruses, and the spread of this virus is very fast. It is more transmissible. It is not something which will allow us to develop herd immunity, and also may create problems are testing and vaccination. With that in mind, I think the surge is more than we expected, and it is likely that the deaths which follow, generally the case fatality which generally comes after 2 weeks or so, we may be in for difficult times. I think the government of Delhi, and as I see the bulletins, they have enough number of beds in the government setup. They also have beds created in several large hospitals in Delhi. I think we need to understand everyone who is sick does not need to go to the hospital. The Chief Minister has said only those who require a symptomatic condition should go to hospital. Otherwise, we'll fill up our beds with asymptomatic people. We need to understand these can be done at home. For that, I think Delhi had been well prepared.
Dr. Sareen, this morning I was seeing the Corona app. At about 10 a.m. in the morning or so, there were 101 COVID beds with ventilators, ICU beds with ventilators for COVID patients. That went down sharply over the next many hours. At one stage, it was 60 odd or 63 odd beds within 3 hours. And then it jumped up further, and now there are 184 beds when I checked last. What is the ventilator situation in Delhi?
Well, as far as last year versus this year, two things have come. One is most of the specialists, the anesthetists and the critical care people, pulmonologists, have changed from ventilator to high flow oxygen. And high flow oxygen has been a huge support. And actually low tidal volume, low pressures are the way that you do not produce injury. So that way we have decreased the pressure on ventilators, which in any case are in adequate number. So firstly, people will be given oxygen in the hospital, high flow oxygen. Rarely you would require a non-invasive ventilation which is under high pressure. You put a mask and give high pressure. And fourth level would be actual intubation and ventilation. For that way, I think Delhi has good protocols, and all the hospitals are very well geared for this.
Dr. Handa, we were speaking sometime earlier on. Could you describe for us the tsunami of cases coming into the ER in your hospital, Mulchand?
Yeah, we have had literally a tsunami of cases, and I had said that though we have increased beds over the last 1 week or 10 days, we still have a waiting list of about 50, 60. I mean, that's what we keep on telling. Please give us your name. We will put you on the waiting list and we will let you know as soon as any patient gets discharged. The government has come out with the discharge policies also, and we are following those discharge policies. But we still have, one patient gets discharged and the 2 patients are waiting to get into that bed. Plus, we have converted all our single rooms to double rooms. There are no single rooms, and we request, because many patients want single rooms, but we request them, we do not have single rooms. We have converted all single rooms into double rooms.
Dr. Handa, could you tell us what your doctors and your nursing staff are going through on a 24-hour basis?
Yes, a lot of doctors have opted for that. They have personally come up. These are the resident doctors who have had done COVID duties throughout the year, during the last wave also. They themselves have come out that we will do 24 hours. I mean, that's very appreciable of them. I mean, they have said we can do 24 hours duty because we have shortage of manpower also now. And healthcare workers are also getting infected. So that leads to another reduction in the manpower. So everybody has to manage somehow, and I think everybody is pitching in and doing their bit, even doing 24 hours duties if they have to do 24. You can imagine a doctor wearing a PPE for 24 hours. We advise them to, after 8 hours or 6 hours, to go out again and refresh themselves and come back again. We change your PPEs and come back again. But yes, they are doing 24 hours straight duties.
Dr. Trikha, could you tell us what your doctors are doing, people like you are doing, your nurses are doing, the janitors are doing, sanitation workers are doing with these numbers?
Yeah, I think it's right you've talked about the paramedics also, because they are the ones who ultimately matter a lot to us. Our resident staff we put them on a 6-hourly duty, and we have enough of them on our board, and they are good enough to be doing it for the last 1.5 years. Some of them have left, the new ones come in. We have a rotational policy. The nurses too are with us, and the technician staff also. The issue is not only beds, the issue is that we need the paramedics, we need the doctors, but then at this time of what we are seeing, what I think is we'll have to stop all possible elective admissions and surgeries in all hospitals in Delhi. Let's be very clear. If somebody has to have a hernia operated, he may come after about a month or 2 months. Unless we have more number of beds and all of the elective surgeries are stopped, elective admissions are stopped, we really can't fight this tsunami, what you've called a tsunami. It is more about 17,000 patient or whatever you said, 10%, 15% positivity rate. It is going to go up in the next
16% positivity rate and 17,282 cases. I mean, yes. I'm looking at this number, at the official document I have. It's astounding.
Yes, I also have that document. I saw it just now. This is going to increase, I assure you, in the next 10 days. There is no reason it will not increase. We've already thinking about, we've added more beds. We've opened up another center which was ready. We are going to add more beds at AIMS. But what is required is, if you've seen your visuals, did you see the visuals at Nigambodh Ghat? At least 3 people were wearing masks which were below their nose. Well, this is not going to work for us. This is not going to work for anybody of us. Dr. Sareen has correctly pointed out that each one of us will have to go into a lockdown. It's a self-imposed lockdown. The government may do it or the government may not do it. It is for them to decide. We as doctors are nobody to talk about a lockdown. We are not financial wizards, but each one of us has got to do it. And yes, we are going towards a tough time. It's something like a war-like situation. We'll have to have hospitals who would stop all possible elective admissions and surgeries.
Gaurav, what did you go through to get beds for your loved ones?
Oh, I don't know how to start, but it was a nightmare. And 10 to 12 hours of just running around from one hospital to the other. And I'm talking of private hospitals. I'm not naming hospitals here because the idea is not to shame anyone. But one thing is very, very, very clear, that these claims of beds being available is false. I can tell you for my own self, my mother-in-law fainted outside a private hospital. She was standing in the heat for 3 hours. I had to bring in the car, switch on the AC and request them to let the car be parked there. But they checked the stats. the doctor saw some patches in the lungs. This was the test done a day prior, and she was advised hospitalization immediately. We ran to one hospital, to the other, to the third, to the fourth. But the scenes were scary. I can't even blame anyone. The scenes had to be seen inside those hospitals. They were overwhelmed. I don't understand who to blame. The health workers were working like warriors. They were doing their best. But one thing is clear, Vishnu, that the total available means somehow don't seem to add up to the gravity of the problem. I'll be very honest. I myself was not taking this seriously. Maybe I was partying around, stepping out of the house. But yesterday was the first time that I actually stepped out and saw reality. And all I can say is that I am sad, disappointed. I just don't know what to do and what to say. It's grim.
Did you finally manage to get the beds for your
Yes,
father and mother-in-law?
after 12. Yes, after 10 to 12 hours at around 8:30 in the night.
Are they all right? Are they getting better? Are they stabilized?
Thank you for the concern. Yes, they seem to be much better. The tests are still on, and we are waiting for a few results tomorrow morning. But things seem okay and good right now.
Okay, so Dr. Sareen, now let's talk a little bit about, let's talk to people over here on this program who are watching this program and tell them what they should watch out for, when they should consult a doctor, and when they should try and get to a hospital. So medically, what do people need to do?
Well, it's like, the virus is spreaded to 15% of the population. Let's take Delhi as 2 crores. So there may be at least 15 lakhs to 30 lakh people who may be having the virus right now. We just sample 1 lakh, which is a huge number for any city, and you find out 15% are positive. Now, if that is the number, then a large number, 80% of them may be asymptomatic. They have just the virus, they got it detected. Like we have patients who come to ILBS and their attendants are positive, patient is not positive. Attendant is just routine checkup. Every attendant is tested. Now, such people need not run to a hospital if they have only their heart rate has gone up to, let's say, above 110, or if he is an elderly person and saturation has gone to below 93% or so, or he has severe cough and the fever is not remitting, then such a patient, and if he has comorbidity, he should be taken to a hospital. I mean, there are standard protocols for that. So everyone need not go, and everyone should not go to a major hospital because he doesn't need plasma, he doesn't need all that, everyone. So therefore, one should rush to a nearby hospital where can be facility, and do not crowd places where there are intensive cares, where there are limited resources of highly qualified technical people. So in my opinion, like any other flu, and this is going to stay, this is like a villain which will go and come back. The virus is not going to disappear just in a month or two, it will keep on coming. So we have to understand that we are learning on the job, and that rest of the country and the people must cooperate. For example, there were people who were saying, oh, we had to wait 4 hours, 6 hours before the doctor saw us. Well, you make a good food, you wait 3 hours, 4 hours to have a good vegetable. Similarly, RT-PCR takes few hours. You can't just put a swab and give you a PCR results. This is the process. It will take 4 hours for an RT-PCR, at least 4 hours. Places take 24 hours. So therefore, we people have to understand that the test will take time, doctors are overworked, so we have to cooperate and have to have some patience. With that in mind, how do we manage this? In my opinion, if we all promise 100%, irrespective of caste, creed, religion, stature, that we are going to use a mask and we use the mask in a proper manner, the spread cannot occur. There is no way the virus can infect the other person. And especially hospitals, if you wear double mask, although there is not much evidence, the doctors and the house staff can be totally protected. So in my opinion, if we all promise, and through your media, everyone does that, it will be a great benefit. The second part I also want to add is the spread of mutant virus is much faster. We may not have enough time. We need new vaccine platforms. We need to develop, we have only first generation vaccines. So to prevent the spread of mutant virus, we must develop concurrently our ability to sequence, our ability to see that we can develop new vaccines.
Dr. Sareen, why do we still not know the exact strain? More than a month after the surge happened all over India. Is it the UK strain? Is it a double mutant indigenous strain? What is it? We still don't know. We know it's all there, but we don't know which one is the one responsible for all of these numbers. And if we don't know this, how do we fix it?
Yes. See, it is Darwin's principle. You know it, Vishnu. Darwin's principle is survival of the fittest. The virus has to survive. And to survive, it has to change. And once it changes multiple times, let's say you have gone to a large mela, one person has given to other. To survive, it has to change. And till now, about 5,000 mutations have come. And what is now known as VOC,
right,
the
variants
variant
of concern.
Yes. The variant of concern are few. And these mutations in the virus are the ones which are spreading fast. And that probably is the cause of our surge of the virus. So let me ask
Dr. Trikha this as well. Dr. Trikha, why 1 month down the road have we been unable to scientifically match what we are seeing clinically? Why?
Okay,
there's no dearth of cases.
No, there's no dearth of cases. I'm sure people are working on it, and finding out strains of a mutated virus is not a 1 hour job or a 2 hour job.
1 month plus, Dr. Trikha. That's why I'm asking this.
Just a minute. Let me finish, Vishnu. I know it is tough. I know it is taking time. But what is more important here is, if I know the strain is X, Y, Z, my treatment doesn't change. My treatment is just not going to change. The way the strain changes, maybe the person who's going to make a vaccine is going to do something else. As far as I am concerned, at this time, our main concern is how to treat our patients and how to avoid the spread. If we knew, let's say we knew that it was a triple mutant strain, what are we going to do? We as physicians, we're going to do the same things. We're not going to get new drugs. Some new monoclonal antibodies are in the pipeline, the ones with Mr. Trump had in the US. Maybe they come to us. Just remember that anything for human use takes a lot of research, a lot of experimentation, and to be used. Phase 1, phase 2, phase 3 trials. And in an emergency situation, we can overrule all that. That's perfectly fine. But if you tell me the strain was Delhi mutant, or let's say Amritsar mutant, or a Bangalore mutant, my treatment is going to remain the same. I can assure you that. We don't have a specific drug for a Bangalore strain.
No, this is a very important point. I take that. And Dr. Handa, therefore, based on what Dr. Trikha has said, how important is it to have vaccinations? Because this is another thing that has happened. In the last couple of days, the number of people vaccinating in, let's say, Delhi has not been at the number which perhaps it should be. And what a lot of doctors say is that the vaccine helps you to build up antibodies. And therefore, the chance of this becoming more serious or possibly requiring hospitalization goes down. Is that something, firstly, am I right in that?
The vaccinations do not prevent you from having the infection. They will prevent you from the severity of the disease. That is what, I mean, you cannot, you will transmit the disease and you will get infected. The vaccine does not prevent that. The vaccine only prevents, if you have, the vaccine only prevents you from having a severe form of the disease. That is the only thing. And I think that is the only preventive sort of shot or preventive vaccine or preventive medicine that we have at the moment. But other choice do we have? So vaccination is mandatory. It should be mandatory. At the moment it's voluntary. I think the government should make it mandatory for everybody to have a vaccine. And vaccine hesitancy was there, but now since the surge is there, there is sudden demand for the vaccine because everybody wants a vaccine. So now there is a sudden shortage of vaccine. Otherwise, I mean, the vaccines are there.
Dr. Trikha, you want to add something to that?
Yes.
The importance of
I
vaccination
want to add
now?
a few things about vaccine, Vishnu. Thank you very much. There is I got my second shot, right? When I got my second shot, I had to wait for about half an hour because there were not enough 10 people for a while to be opened.
Right.
This is what is happening. And the other thing is that suddenly you read one day on WhatsApp that there have been some cases of clots and something has been withdrawn in Europe. Fine. So there's a lot of hesitancy which comes back again. Covishield versus Covaxin, and now it will be something like Sputnik also coming in. So let us decide. Let us decide that we will not make our decisions on what we reach on WhatsApp. These vaccines which are released in India are pretty safe, and they have the incidence of abnormal reactions or fatal reactions which are acceptable all over the world, right? We are just a lot in number and we get a lot of information which is just not from the right sources. People are making newses on WhatsApp and they are getting popular about it. let's all get vaccinated. Now we have the third one, maybe we'll have the fourth and the fifth one also. Okay, that's perfectly fine. There will be side effects. There would be an incidence of side effects as far as all drugs are concerned. Mind you, some people die of taking aspirin every year. All over the world, we don't stop taking aspirin. It is all there. We have to take our precautions. We've got to get vaccinated. And this issue about clots or somebody dying within 1 hour of the vaccine, somebody getting COVID after the second shot within 3 days or the first days, this is all part of the job, part of the game.
All right.
We see it. So let's all get vaccinated. And I hope you should insist that you will only have those people on your panel who are vaccinated.
Yeah, I'm vaccinated and I'm pretty sure
that's very
everybody
good.
else is. So,
I am vaccinated.
so my question, doctor, is do I get my second jab at 28 days, Covishield, or should I extend it to allow other citizens? What is the answer to that?
No, it's 6 to 8 weeks. 6 to 8 weeks as per the latest advice which is from the government. Let us follow the government. The government consists of people who are knowledgeable. They have the right people who make the decisions.
Gaurav, last word to you. Gaurav, sir, Dr. Trika, I will talk to you later. This conversation is not over. But Gaurav, I have 30 seconds left on this program. You had a terrible experience. What do you have to say to people watching this?
Well, I'll just say, guys, please wear your masks. Step out only if it is extremely, extremely important. And that is the only thing that can save you. I have learned it the hard way. I hope everybody else learns it. I have a small question to the doctors here. When will 40-year-olds be allowed to take this? Because a lot of my friends, people of this age are now suffering from this.
I think that's a million-dollar question, and we will certainly get to that sooner than later. Actually, it's a 250 rupee question because that's what it is per dose in a private hospital, free if you get it elsewhere. Hopefully that will happen soon. I'm out of time. We'll keep talking about this.